2021, this Cabinet submission will go into depth about a long-term care reform in Ontario, focusing on the sustainability of home care. As the Canadian aging population continues to increase, more seniors will require formal and informal care. Waiting lists for facility-based long-term care homes continue to rise, and seniors are having worse health outcomes due to the lack of access to care and resources. To maintain seniors in their home, access to home care services is required. Sari et al., 2017. For any action to be taken, the Cabinet's approval is required to implement a deductible and co-payment system to allow for home care services to stay sustainable and contribute to increased access of home care services. Ontario seniors should be able to reside in their preferred location, while regulations enhance that those who reach out for help are able to receive the aid that they need without having to wait a prolonged period of time, thus ensuring that seniors who require help should not have to qualify for care. The main government agency that will be involved in actioning this decision will be the Ministry of Health and Long-Term Care. The Ministry of Health and Long-Term Care is responsible for coordinating and administering the healthcare system by providing services to the public in Ontario through programs such as home care. Ontario Ministry of Health and Long-Term Care, 2018. The local health integration networks will then be responsible for implementing these changes and services to help provide home care. Once the decision has been approved by the Ministry of Health and Long-Term Care, 18 months will be needed to address these changes to each LHIN. A thorough plan will have to be developed to allow time and instruction for our healthcare agencies to coordinate and get more healthcare providers to provide care to those in need. An additional 12 months will be needed to develop a co-payment and deductible system to finalize the financial costs for seniors using the program. Furthermore, this additional year will also allow for time to develop a plan on how the system will be effectively implemented. All health professionals involved in delivering the information on this new system will have to be well educated to ensure that the most accurate information is being delivered to those in need of home care services. Through the collaboration of LHINs, the Government of Ontario, and home care employers, strategies need to be put in place to ensure that an adequate number of home care staff, such as nurses and support workers, are available to meet all the demands of services. Patterson, 2016.
Delivering the most effective and sustainable long-term care is a global concern, especially as technology advances and increased knowledge allow us to care for those outside of the hospital in patients' homes and communities. With the ability to look after people in their homes and keeping people alive longer, there have been two main challenges. Meeting the demands of the growing population of people receiving in-home care, which is tied to the second challenge that is delivering a financially sustainable care. Policymakers have continuously struggled with how to provide long-term care, including the balance between facilities and community care and how these different services should be financed. Suggested policy approaches have included various combinations of expanding the definition of insured services to include publicly funded coverage for post-acute clients as well as those needing end-of-life care, a tax credit/tax deductible for home care consumers, and an insurance fund for home care. Different provinces base their coverage decision on categories of service and individuals. This may be based on age, income, region, or clinical diagnosis. This is related to the question of which service the population believes should be publicly paid for. Accessibility is a struggle for many clients in the community. The increase of prices in turn cause lower service volumes, which cause stricter eligibility and therefore causes consumers to have insufficient access.
The first issue in relation to the sustainability of home care in Ontario is due to the increase in the senior population. By 2041, 25% of the population in Ontario will be over 65. The home care system already is experiencing the effect of an aging population. From 2008 to 2012, there were 42% more individuals being released from hospital to home care services. This is due to the fact that hospital care is much more expensive than home care. Therefore, hospitals would much rather send individuals home sooner if they believe home care services could do the same job at a much lower cost. However, Ontario is not ready to handle the influx of an aging population using home care services. This is due to financial strain and little reform that has happened over the last several years. The second issue in relation to the sustainability of home care in Ontario is the request for more services. As of 2015 to 2016, 74% of home care services in Ontario were for personal help and housework, such as showering and doing laundry and meal prep. These types of services are provided by personal support workers, also known as PSWs. However, Ontario is currently experiencing a shortage of PSWs. This is due to the fact that PSWs experience poor pay, poor accountability, such as the Ontario government doesn't actually know the amount of PSWs working in Ontario, and substandard work environments. Many PSWs experience abuse from patients and have no formal training to deal with these issues. Therefore, PSW care is critical to the home care system. However, due to the financial strain on home care already, few of these issues are being resolved. The third issue in relation to the sustainability of home care services in Ontario is regarding new regulations that have been added to the Employment Standards Act. These new regulations include pay for cancelled shifts, pay for on-call work, and the right to refuse work. Although these regulations are important for workers, they will cost the Ontario healthcare system an additional $85 million a year. Therefore, this cost will only further strain the Ontario home care system that is dealing with an increase in users and a financially strained system already.
The overall goal is to increase access to home care services for the senior population in Ontario with the focus of a deductible and co-payment plan. Principal options are to increase home care access, as it is typically less expensive than acute care and usually preferred by the individual. Most people requiring long-term care facilities could be treated at home if the appropriate services were made available. Prevention and maintenance care provided at home can keep people healthy enough to remain out of institutions such as long-term care homes and hospitals. This can prevent further costs and keep individuals at home for longer periods of time. Ontario's healthcare system needs to further develop of home care services to meet the chronic and complex needs of our aging and growing population. Currently, individuals receive home care free of charge if they are considered eligible. The LHIN determines who is eligible and provides contracted out services to clients. It is predicted by the Canadian Medical Association by the year 2036, 25% of our population will consist of seniors. With the influx of seniors in the upcoming years, Ontario will need to develop a more sustainable way to offer home care services to our seniors. Other options include increasing programs offered for seniors living in the community, as well as increasing the total number of long-term care beds over the subsequent years to accommodate the demand needed. To accommodate more long-term care beds, creating a more predictable approach to funding could aid in supporting this. Having more stable funding would contribute to safeguarding and stabilizing the future of long-term care facilities. Creating more programs for seniors that are paid by the individual or insurance/deductible program could eliminate some of the current paid services offered. Making current government-paid home care services more directed at nursing care, such as those who are being discharged from acute care or palliative care in the home. If the case was left as status quo or nothing further is done with the current system that is in place, the future of many seniors' care is at risk due to lack of health services available. These individuals are compromised of care, and there are inequities in health resources available for Ontario seniors. Throughout the healthcare system, patients are facing increased wait times for both acute and long-term care services, and there is a discontinuity in care.
Today's seniors in Ontario have complex medical needs that must be supported by the health system that they have grown to depend on. Rather than finding help from the health system, they find excessively long wait lists or accommodations that do not meet their personal preferences. According to the OLTCA report, last year the long-term care sector in Ontario consisted of 78,519 beds. A total of 114,082 seniors were supported using those beds, but still over 20,000 remained on the wait list for placement. The province estimates that over the next 10 years, there will be approximately 50% more seniors over the age of 75. This growth in population will have a great impact on access to services and put additional strain on the healthcare system that will care for our parents, grandparents, and for us in the future. The cost of care in a long-term home setting is rising. As of July 1st, 2018, the cost of staying in a basic long-term care home is $60.78 per day, or $1,848.73 per month. Not many can afford this rate, so another option is to have care provided in the comfort of the individual's home. Service rates vary depending on provinces, but on average, the bill rate in Ontario is around $20 to $30 per hour for home support and personal care. Professional services, including nursing and therapy, are significantly more, depending on the service provided, around $50 to $60 per hour. However, these costs would be discussed with the home care provider as different arrangements can be made depending on the type of service. Financial relief is available for seniors under the Ontario Drug Benefit Program. A single senior with an annual income of $19,300 or more, or a senior couple with an annual income of $32,300 or more, are eligible for a copayment. Seniors who are part of the copayment program do not pay an annual deductible and receive a copayment of up to $2 for each prescription. Seniors will save approximately $130 on average per year in out-of-pocket drug costs. According to the data from 2011 Home First Shifts Care for Seniors to Home, on average, the cost of care at home is about $42 a day when compared to care in a hospital setting, which is around $842 a day. The only service that will be subject to copayment and the deductible will be PSW services, such as meal prep and bathing. The copayment and deductible will be based on their income and will be affordable for all. The system will not cause any additional expenses to implement, as it will be added on to the health card. In the end, the main goal is to have seniors stay in their home while also making it affordable. However, since 74% of care comes from PSWs, they are the most readily used service. More PSWs should be hired to assist the aging population, as the Ontario government cannot solely fund these services. Home care has many benefits, as it would help improve patient health while also decreasing costs for seniors. Promoting more home care and implementing a deductible and copayment system lets the elderly individuals access care without any barriers.
The economic and employment impact for the family home care provider aspect, the copayment system could ease workload for family members who have to provide home care. Family members who provide home care can find their own job or keep a normal work hours as usual. Don't have to face the problems such as unplanned leave, reduced hours of work, lateness of work, and possible income loss. For the professional home care provider aspect, the copayment system could create more job opportunities as the payment for care recipients is no longer as high as usual. The increased use of more advanced device and technology and a more complex pharmacology have made it possible to provide a broader range of healthcare service at home. Therefore, the specific medical professional will be sent to patients' home to provide more skills and medical knowledge service than before. This leads to better salaries, better combination of work schedule, more stable income.
Home care has many benefits such as decreasing costs, improving health outcomes, and reducing hospital stays. Ramagnoli, Handler, and Hawkheiser, 2013. By implementing a deductible and copayment system, more seniors will have access to home care, and this type of care will benefit elderly patients the most in a way that is patient-centered to offer holistic, sophisticated, and individualized care to elderly patients with comorbidities who are living with both serious and disabling conditions. Home care is access to health care, which is the most relevant to those elderly patients with physical and socioeconomic barriers to care, increasing patient safety and satisfaction overall. Elderly patients will trust their caregivers more because intimate clinician-patient relationships are created through home care services. By introducing a deductible and co-payment system, elderly patients will be relieved of the burden of high costs as home care can lower the costs for services, which is a huge factor that is desired the most by patients. Rosati, 2015. Families of the elderly patients are the next group of individuals who will be the most affected by the decision. Attending to the needs of an ill elderly person can be a burden on families as they need to be shouldering the tasks of dressing, feeding, medically nursing, and comforting the patient. Hogg, 1985. Home care can relieve this burden, and caregivers can come to the family's home and take over some of the tasks to provide holistic, patient-centered care in the comfort of an individual's home. Families will not have to worry about taking their ill elderly loved one to the hospital and can have care in the comfort of their own home. By implementing a deductible and co-payment system, more seniors will have access to home care, and this will greatly benefit the community as well. Having this system could decrease the amount of individuals waiting to get into nursing homes and further decrease the strain on hospitals. In 2010 and 2011, over 271,000 emergency room visits were made just in Ontario hospitals for treatments that could have been made in alternative primary care settings. Government of Ontario, 2012. All of these ER trips were avoidable, and these patients could have received optimal care at a much lower cost. In essence, if more seniors are receiving home care, it will increase the number of hospital beds available and decrease wait times and the strain on hospitals, which greatly benefits Ontario residents. Sutherland and Crump, 2013.
The intergovernmental relations impact. The costs for intergovernmental are also affected due to indirect costs of absenteeism, which is overtime and the replacement works. The unpaid work done by informal caregivers, such as family members, often generate costs for governments and society in general. For example, one person withdraws from their work to take care of an independent family member means a current and future decrease in the state's tax revenue. In addition, the effect that a person leaves paid employment to provide care also means that this person will be much more likely to depend in return or public income insecurity programs.